right, well, good afternoon, everyone. My name is Dr. Sigrun Hallmeyer. I'm a medical oncologist at Advocate Lutheran General Hospital, and I'm also the director of the Cancer Survivorship Center here. And today our topic is scalp cooling to prevent hair loss as a consequence of chemotherapy. And here at my infusion center, we've been using this technology for a number of years. After I had a very dear patient of mine introduce this technology to me many years ago, before it even was kind of standard of care and was FDA approved. And really her stance at the time was that she would only accept chemotherapy as part of her treatment if I would find a way for her not to experience hair loss throughout treatment. And so it motivated us to kind of look at the state of the art at the time. And back then, scalp cooling was really in its infancy. The only way that this was administered is by patients bringing in their own scalp cooling equipment, which required a swimmer's cap type of construct that needed to be placed in the freezer overnight. And they had exchangeable sort of inner portions to it that she would bring with her to the clinic in a big cooling box. And they would last about maybe 20 to 30 minutes at a time. By then they would be melted and needed to be exchanged to another one. And we saw a lot of sort of inferior results with that, and also a lot of freezer burns, especially on the ears and on sensitive parts of the skin. And so this was many years ago, but nevertheless was sort of the birth hour of scalp cooling, where now much of this is automated. And here at our practice, we have a system called the DigniCap system. It's not the only one that's FDA approved and also no longer the only one on the market, but that's the one I'm going to be talking about mostly today because that's where my experience is. So with that, and please, Davina, keep me honest here, I'm going to start sharing my screen and see if you would be so kind, give me feedback, make sure that you can see my actual.
Perfect.
Yeah, it's working. Yes. Right, fabulous. So now I just got to go here as to how can I forward them. Give me one quick moment. We're getting really good at this, but still not perfect. All right, so you see the title slide?
Yes.
Okay, wonderful. So let me see here, slideshow, resume. Okay, is now the second slide up? I'm sorry, I can't see what you're seeing.
It hasn't loaded on my end yet.
Okay. Do you still see the?
But it's loaded for people here.
Okay, very good. So I'm going to click on this video and we'll see, hopefully that'll load with its format like we just tried. Savina, if you could tell me, is the video screen visible?
It's not. I wonder if you can stop sharing and reshare your screen with the video.
Yep, I'll try that.
Perfect.
Yeah. All right. So this is an introductory video that was actually broadcast in 2017 when the DigniCap system was just approved by the FDA. But I think it gives a pretty nice little 2-minute overview as to how this is received by the public.
All right, this Tampa Bay woman was just told last October that she has breast cancer.
There aren't a lot of options when somebody tells you something like that. But for Carrie, she did have one choice, and that was to keep her hair, all thanks to this special cap.
So I'm going to order a new bottle.
It does work.
It looked really good.
Yeah.
Carrie Kinsella isn't getting her hair styled, but rather trying to preserve it.
We had a good fit last time.
Yeah, we did.
And she's doing it with the DigniCap, the first and only FDA-cleared scalp cooling system for patients undergoing chemotherapy to reduce their hair loss. But Carrie won't be a breast cancer patient for much longer.
Today is my last day of chemo. It's a good day. It's a great day.
The DigniCap has been a staple in her cancer crap bag since she started chemo at the end of last year.
I could lose my hair and I could just say, yeah, that's fine. That's how it's going to be. But this gave me a choice.
Simply put, it cools the hair follicles in the scalp, cold enough to protect them from the powerful chemo drugs.
They've had the opportunity to not have loved ones really know that they're going through this because they want to protect them.
And while not comfortable,
it's like I get a brain freeze about every 2 minutes, even as we're talking, and then after about half an hour, your scalp just kind of goes numb.
Carrie says it's worth it. It's not covered by insurance, so through a neighborhood event, Carrie has raised $7,500. Not for herself, though. but to provide the caps for women who otherwise could not afford them. But for now, this Wonder Woman never has to wear one again because that sound means she has completed her chemo, and as she put it, ready to get on with her life.
It's awesome to hear.
Gosh, it was so great to see her. This is fairly new at Moffitt. Carrie's oncology nurses, 21 Moffitt Cancer Center patients have been treated with the cap.
Okay, so hang on, let me go back and I'll start sharing again with my presentation so we can get back to our topic here. All right, very good. So this was really just a snapshot as to what it looked like in 2017. And there's actually been some modifications to the system since then. So this is the product that we're using here at our practice now, which is the actual cooling system. And it comes with a cooling unit. And Savina, can you still see my face in a little box in your presentation?
Yes.
Awesome. All right. So I'm going to actually show you, you saw in the video from the TV show how that was almost like a tight fitting swimmer's cup. And what we noticed is that a lot of patients would actually lose a lot of their hair on the crown of the scalp because it wouldn't really fit well. You need to have an almost perfectly shaped head for that to work well for you. And so they have updated the system now for this type of thing. It's a wrap that is much more three-dimensional, as you kind of imagine here, you know, so it comes around and really protects your hair a lot better because there's many different ways how you can adjust the actual wrapping with the cooling strips inside of it. And with that, you get a lot better adherence to the scalp for a much more uniform cooling that needs to happen. So the idea of scalp cooling really is that we're trying to cool down about 1 centimeter of your scalp to refrigerator temperatures. So it's about between 3 and 5 degrees Celsius, which is the same temperature that you would feel when you put your hand inside of a refrigerator. If you've ever done that, you know, put your hand on one of the shelves and sort of let it sit there for a little while. That's how it essentially feels on your scalp. So it is chilly, but it is very tolerable. But the big difference is that this refrigerated temperature is very safe for our skin and even the skin on our ears and the facial skin, unlike it was with the, you know, sort of first generation cooling caps that used ice, because with that you get freezer burns because obviously the temperature there is below freezing. And with that you can get injuries. This is not below freezing. And so with that is actually a lot safer and equally effective. Now, this particular unit comes in 2 different designs. It can serve 1 or 2 patients at a time through the same cooling unit. And we have the one where we can have 2 patients at a time be on the same machine at 2 different cycles. Now, a big question always is, and maybe even for you here that are, you know, tuning into this program today, is why would somebody even do that, right? And so what I can tell you for my patient population who is utilizing this technology is that they really are seeking a methodology to go through treatment in sort of in a sense of anonymity, you know, by losing your hair as you're going through chemotherapy, even with the very best wigs. Many of those patients are quite exposed to neighbors, to people in the grocery store, people at work, etc. And so hair loss in general makes the cancer diagnosis very public, and then sort of exposes these patients to, you know, the pity and the, you know, discussion. And unfortunately, maybe for some of you who are on this call today have had that experience. Once a cancer diagnosis is public, that patient often gets targeted for lots of, you know, information and help, which is wonderful, but also unwanted information, you know, where people will volunteer all kinds of things. And it makes it very, very stressful for patients to go through this without rejecting, right? And so in a very short sentence, really, it is sometimes easier to go through such a diagnosis and treatment without it being broadcasted to the entire, you know, sort of global friendship, a circle of friendship and colleagues as this is happening. The second thing that I have absolutely observed in my patients when they're going through chemotherapy and lose their hair, the emotional aspect of that is very deep, and typically, it's much deeper than the actual treatment duration, because obviously once a patient loses his or her hair, it takes several months before the hair grows back, and oftentimes the quality of the hair is different. You've probably heard people say that the hair comes often back curly or thinner, different texture, and harder to style. And so the emotional cost that comes with hair loss really exceeds beyond the treatment duration. And so in my patients who have been successful in preserving their hair throughout treatment, I have noticed that in general, obviously their emotional state, their quality of life, and their entire satisfaction with their appearance is significantly higher. But in that, I also noticed that patients typically are less fatigued and have less physical effects from chemotherapy, less nausea, less, general malaise and those type of things that come with chemotherapy. So there is certainly something that needs to be said about, looking into the mirror and seeing somebody who looks like yourself compared to somebody who just looks like a sicker cancer patient without the benefit of having their hair. And then also many of our drugs, although relatively rare, can induce what we call long-term alopecia. And that's the word that we use by saying that the hair does not come back, and so the percentage rates differ depending on which clinical trial you're looking at, but it's anywhere from 2 to 8% of patients who receive chemotherapy where the hair actually does not come back, or does not come back in a way that would be satisfactory to the patient. They may have residual bald spots or complete sort of thinning of the hair where you can see the scalp through their hair permanently. That's not fixable. And so the risk for that is also reduced by using the scalp cooling, obviously ultimately preventing the hair to fall out from the get-go. And with that, the risk for long-term alopecia is significantly reduced. Now, how does it work? So again, the idea is that we want to apply a refrigerated temperature to the outside of our scalp, and the follicles sit within the layer of about 1 centimeter, so about 1/3 of an inch within our superficial skin of our scalp. And the idea is that obviously when we give chemotherapy into the vein, it goes throughout our entire body, which of course is the intent, right? We want to make sure that if there's any microscopic disease that exists in our patient who's receiving chemotherapy, that these cells will be exposed to chemotherapy in their liver, in their lung, and their bone marrow. And so even the blood flow that goes through the blood vessels in the scalp will contain the same amount of chemotherapy. And so when our follicles that are situated in our scalp are bathed in the chemotherapy that is within our blood, that is when we encounter the subsequent damage to the hair follicle and the hair loss. And by inducing a cold-induced vasoconstriction, so the blood vessels actually clamp down, and ultimately the chemotherapy cannot travel into those blood vessels and cannot expose the hair follicles, and that's ultimately how we preserve our hair. Now, it needs to be understood that when a patient signs up for scalp cooling with their chemotherapy, it extends their treatment duration quite significantly, because obviously it takes time for the blood vessels to constrict down, so no further blood flow happens around the follicles. And also the chemotherapy, once the needle is disconnected and the patient's chemotherapy is infused, it takes about an hour or so for the chemotherapy to be metabolized through our organ systems and no longer be chemically active in our bloodstream. And during that time, we need to still continue to vasoconstrict the patient's scalp follicle blood vessels in order to minimize the exposure. So that means that patients have to come typically about an hour before chemotherapy to be started on the machine to induce the complete vasoconstriction. And they need to stay on the machine for typically an hour or so after the chemotherapy in order for the chemotherapy to be metabolized by the patient's organs to become, the blood essentially be freed of the chemotherapy agents and no longer affecting the follicles once, the scalp cooling is let off and the vasoconstrictions will be released. So there's a time component, okay? Now, the next slide here shows the published data. And as you heard in the little video clip, this is now a number of years ago that the FDA already approved the DigniCap specifically as a system. There's other systems that since have now also achieved FDA approval. And these systems are also now part of our NCCN recommendations. So this is the National Network for Cancer Care that is essentially sort of our Bible when we look at what is appropriate care for our patients with a cancer diagnosis. And they have a very, very significant sort of rubric on supportive care in which this is housed as part of the recommendation to prevent hair loss for patients. Now, what you can see on the very initial clinical trial that was published in 2015 is the success rate is not overwhelming, right? Only about 2/3 of patients kept the majority of their hair. So there is definitely still limitations on that. So I always warn my patients as well, just because you're signing up for this and you're going through this intervention, I cannot guarantee that this will work for you. You know, our chance is about 2 out of 3 patients. And really the way they measured success in this clinical trial isn't so much the amount of hair loss that was encountered, but rather the need for needing any additional device, for instance, a wig or a scarf or a head to cover the patient's head. And so with that, you know, you still need to anticipate a very significant amount of hair being lost throughout treatment. To exemplify that here, this next slide actually shows directly from the publication. This is in the Journal of American Medical Association, a JAMA network in 2017. So right in that year when the FDA also reviewed the data and ultimately issued the FDA approval. And you can see the 2 panels on the left from top to bottom show a patient before treatment. And then the second column here is after treatment. And she had essentially almost no hair loss, and that would be a success story, you know. So she falls into what they call a Dean score of 1. So her hair loss was limited to more than 0%, but less than 25%. And so that would have been, you know, counted as a success. Now, conversely, the patient in the right 2 panels, you see her before her chemotherapy and then after her chemotherapy, where she has lost about 75% of her hair. And that is a Dean score of 4. And in that clinical trial, this would have been considered not successful. And so again, if we're looking at the data here, and I'm pulling up the next slide for that, as you can see, the vast majority of people, 67%, look in the second line from the bottom here, had a Dean score of 0 to 2. And so this is again, which the basis was formed for the FDA approval that 2/3 of patients will have an acceptable results for that. But again, 34% of patients had a Dean score of 3 or greater. So we need to be honest in terms of how we offer that. There's limitations. Not everybody will benefit equally from this intervention. On the bottom right, very small, it's just a quick screenshot of all the chemotherapies that were used in this clinical trial for those roughly 100 patients. And I want to point out to you that these are very specific chemotherapeutic regimens that we use in the setting of breast cancer. Those are not all encompassing. There's lots of other treatments that we offer for chemotherapy in the setting of early stage breast cancer that have very varying success with DigniCap. And so this would be something that you would need to discuss directly with your treating physicians if the regimen that you are embarking on would be supported by the data that we have in terms of hair preservation. Now, in terms of side effects, so this is directly out of this paper, you know, so you can pretty much think of this 100 patients in total treated with this intervention. 6 out of those had adverse reactions. So not too bad, you know, especially if you sort of work in the world that I work in, where we use a lot of the very toxic drugs. Anything that's less than 10% is very manageable. And you can see listed here, the most common symptoms are mild headaches, a little bit of itchiness, pain in the skin of the scalp, some head discomfort. You know, one patient had a moderately severe headache that resolved with Tylenol. 3 out of 106 women discontinued the scalp cooling because of the discomfort that they experience. And that sort of mirrors what I see in my practice. It's relatively rare that I have a patient who will go through this intervention and not be able to tolerate it. 3% is probably about what I see. And then you see the vast majority, 102 out of 106 women who were part of this clinical trial, were feeling chilliness during the cooling period. And of course, we're very aware of that. And we offer our patients in our practice warming blankets, so their body actually stays nice and toasty as their head is being cooled down. And with that, really, most of our patients are actually quite comfortable. Now, more recent data is actually from the same group around Dr. Hope Rugo, who produced the very initial data on the scalp cooling. And this was an update here at the San Antonio Breast Cancer Symposium in 2018, so about 3.5 or so years ago now. Now looking at the longer term follow-up on those patients, those 106, to see if they experienced any type of adverse event longer down the road. And the biggest thing here is right in the middle, that highlighted sentence here where it says no scalp metastases have been reported in either arm. So initially, when the FDA was looking at the data for the scalp cooling systems, they were very concerned that we might be creating a sanctuary site within the patient's scalp. So again, if you think about the concept that there might be microscopic cells floating in a patient's body when they have breast cancer, and those cells are latching on to the liver, the lung, or any other tissue to find a way to survive through chemotherapy. And let's just postulate that that site might be in the scalp, and we're now, causing the vasoconstriction, not allowing chemotherapy to perfuse the scalp effectively. If there's a cell or 2 or 500 that have sort of situated themselves in the scalp soft tissues, could we potentially induce a higher risk of scalp metastases, so metastatic breast cancer recurring on the scalp further down the road. And so that's why this long-term follow-up on patients here in year 1, 2, 3, and 4 after initial DigniCap scalp cooling for hair preservation showed no increased incidence of scalp metastases in these patients, which is very, very reassuring. Now, that doesn't mean that it's all good news, right? There is also very particular contraindications. So still, as of today, unfortunately, pediatric patients have not been studied for these type of interventions and need to be considered, at least for DigniCap, contraindicated. And then you see the long list of different things here that really are outside of the FDA approval for scalp cooling, and specifically for DigniCap scalp cooling. Of course, anybody who has significant cold sensitivity or specific disorders that can be brought on by cold exposure, cold urticaria and cryoglobulinemia, those are all relatively rare conditions, but well described, and they can cause severe scalp damage, when we use this type of intervention in patients who have this problem. It's also contraindicated for patients who have primary brain tumors, because of course we don't want to have any type of incidence where we're protecting parts of the area that we're trying to treat with chemotherapy. And so with that, you see all the different things that are listed here, in which setting we have either concerns about higher toxicity or decreased efficacy of the treatment that we're employing in this setting. And that's how this list sort of comes together. There's also certain warnings, and the warning that I talk about in my practice almost weekly is there is a particular chemotherapeutic regimen that we use for locally advanced cancers, so typically bigger tumors or breast cancer that have already spread to the lymph nodes, where we use the so-called taxanes and anthracyclines. Those are certain drug classes that are highly effective in breast cancer, but unfortunately those two drugs combined are also very toxic to the follicles. And in that, scalp cooling that has been studied with DigniCap has been found to be ineffective. And so for my patients who require this type of chemotherapy for their breast cancers, I don't typically recommend DigniCap. I have had some patients who still wanted to try it because the published data shows success rates in about the 20% range. So that still means 1 out of 5 patients actually is able to preserve her hair. But my clinical experience here also mirrors about what is seen in the published data, that in large portions, over 80% of patients, this is not effective when given with this particular chemotherapy. And lastly, for patients who have metastatic disease, where we ultimately have the understanding that their disease has spread to other systems within their body already, so lung or liver or bone marrow, there we have much higher concern that there are circulating tumor cells within their bloodstream. And so again, the idea of cooling the scalp to create a sanctuary space where these tumor cells may ultimately take hold and then ultimately increase the risk for metastatic disease to survive and, make themselves known, a few weeks and months after the exposure, it has really kept me from using scalp cooling ever, really in the metastatic setting. Now, a couple words about cost, and that may vary from state to state. I can speak to what it is in my particular practice setting. So we are actually sort of in a franchise situation with the DigniCap company, where all the billing is done through their system. And the cost currently is about $350 per cycle. The vast majority of my patients need 4 cycles of chemotherapy, but there's different regimens with different cycles and whatnot. And so each cycle sort of stands on its own for that particular amount of money. And then the initial kit, very much like I showed you earlier, this is actually something that gets sent to the patient's house, is very unique to the patient's particular situation. And so we, before COVID, we used to be able to hand them from patient to patient. They are now all very patient specific. So that needs to be purchased by the patient for about $250. And so again, the total cost typically varies anywhere between $1,500 and $3,000 in total. Now, as you heard in the initial TV clip, when this came initially on the market, insurances broadly would not cover the cost for it. That has since changed, especially in California, where this is much more accepted standard of care. And my understanding is that most insurances in California do indeed cover it. We're moving the dial here in Illinois as well. I have written many letters of medical necessity, and I have several patients who have received full coverage from their insurance. Particularly Aetna is actually one that has been very sort of in the forefront of offering this type of treatment as a covered entity within their patients. But we're moving the dial even with Blue Cross Blue Shield and others. And even if they don't cover all of it, many of them cover part of it. And we also have a fund, and you see many of the national funds listed here in the slide on the right-hand side. Our fund is called the Hope and Hair Fund. And you guessed it, a significant sponsor of that, very much like you saw in the TV clip for the woman that was treated in Florida at Moffitt. My patient here who brought this technology to us ultimately was instrumental in creating a base fund here that is now moving on way beyond her treatment. And unfortunately, she and her daughter both had to go through treatment here and were able to benefit from this particular technology and have been able to pay it forward. And so we continue to receive funds for this particular fund for our patients, and many of our patients are able to get 1 or even 2 or several treatments free of cost if there is significant financial need. You can use your flexible spending account, the FSA, for this as well, which in the very last, if your insurance doesn't cover it and the Hope and Hair Fund doesn't cover the cost, typically that's yet another way to sort of dissuade costs. So hopefully in our day and age today in 2022, cost is typically no longer the prohibiting thing that prevents people from being able to succeed in this. Now, in terms of availability, we started this year and we used to be one of the very few centers in Illinois who were able to offer that. And so we are the little thing here in Arlington Heights. But now with many other systems available, and you see them listed here, the Paxman system, the top one, actually also has FDA approval and is similarly popular compared to the DigniCap as well. But there's others, the Arctic Cold Caps, the Polar Caps, etc. And so this is an actually very recent screenshot here from Google in terms of which sites in the larger Chicagoland area offer scalp cooling as part of their infusion centers. And this may not even be all inclusive, but really for many patients now, this is readily available at their infusion centers. And if not, typically they would know where to refer for, within their system to have access to that. Okay, and that's kind of all I had prepared for in terms of slides. And I'd like to open it up for questions, see if there's anything else that maybe I didn't cover that might be of interest. So I'm going to stop sharing and then see what kind of questions you might have.